Hello everyone, welcome to half an hour of the history of the BSPD for the last 35 years. I hope you're going to enjoy it. I'm going to be talking about the two founder members, John Harper and David Atherton, and other people such as Julian Verboff, who've helped to found the society. I want to give special thanks to Carsten for asking me, although I wish he'd asked me before I'd sent all the records down to Willen House and lockdown came into force. However, thanks to other people like Cameron and Celia and Paula and Nigel and John himself and Julian Verboff, I've received lots of help with scans and other information, so thank you everyone. I have no conflict of interest. This is what I'm going to talk about. I'd like to say that there's so many people I won't be able to talk about, people in clinics, people who've helped to run meetings, people who do the academic side of paediatric dermatology, and they all help to contribute towards our society. So let's start at the very beginning with R.S. Wells, or Charles as he was known, who was the very first paediatric dermatologist at Great Ormond Street, later joined by his colleague Edwin Moynihan. And these two were instrumental in making many people think about taking up a career in paediatric dermatology. Not the least was their registrar then, young David Atherton, who became later the first chair of the British Society for Paediatric Dermatology. He became their first full-time paediatric dermatologist at Great Ormond Street, and in fact was the first in the UK. There were many other people working in paediatric dermatology throughout the UK, but none were working full-time. As a registrar, David had worked with Soothil on food allergy and eczema, and for this he's well known. One of his great friends was John Harper, and he and John and like-minded colleagues spent several hours at many different meetings discussing the foundation of the BSPD, which brings me on to John. He was a registrar at Westminster, and while still a registrar, he wrote the original BSPD constitution. He forged the links with the BAD, and he also forged links with the British Paediatric Association. He became the first UK professor of paediatric dermatology in 2001, and he was made a consultant paediatric dermatologist at Gosh in '86, the year after David. He and David were the first team of the BSPD, and we'll hear more about that later. Cameron's already mentioned his many books, and this is his most famous, the Harper book of paediatric dermatology, but you may not know that he wrote his very first paediatric dermatology handbook when he was a registrar. He was inspired to do this by Julian Verboff, who was one of my mentors at Liverpool. Julian produced this very first paediatric book in the UK, the Colour Atlas, many of the illustrations were provided by Neil Morley, who's now in his 90s and enjoying his retirement. And as a complete aside, he's also the uncle of my secretary at Ninewells Hospital. So Julian, having spoken to Darryl Wilkinson, who was the head of the dermatology section of the RSM, and Ken Sanderson, who was the BAD president at the time, and other people who I'll mention, wrote to Gerald Levine in March 1985, asking if we could form an affiliated group to the BAD. Gerald wrote back a month later, saying in the affirmative that the executive committee had approved in principle this meeting and that this formation of the society, and to get back to him once we'd got the constitution sorted out. So in July '85, John organised and chaired the inaugural meeting at the BAD in London. And you'll see from the annual report that The details of the constitution were approved, and it was unanimously agreed that the BSPD should be affiliated to the BD. And members voted that David Atherton should be chair, John Harper secretary, and the committees were Anne Bingham, Sandra Pierce, Rona Mackay, and Julian Verboff. On the right, I've starred the people who've been chairs, and I'm going to talk a little bit about the other people who helped at this meeting in a moment. The first meeting was Coventry, which I'll talk about, and the first annual scientific meeting was in Sheffield. I remember this meeting at Stratford, the recent advances in paediatric dermatology run by Malcolm Greaves. I think I attended that. And you will see at the bottom in forthcoming events that there was a clinical meeting planned in 1986 in Liverpool, and that was the first time I'd actually attended a proper meeting of paediatric dermatology and presented a paper on dermatitis artifacta. And a little bit about the people who really helped to found the society. Robin Eadie, who many of you will remember with great fondness, who's well known for his work on blistering disorders and genetics of EB. He was a great component of the foundation of the BSPD and on the committee for about 3 years. You may not know that he sadly suffered from renal failure when he was a medical student in the 60s, and it was on dialysis for most of his life. And that he was the longest, in fact, hemodialysis patient in Europe. He was responsible for us receiving free copies of the Paediatric Journal from Blackwell's. You may not recognise her as a student, but I'm sure you all remember Rona Mackay, who was president of the BAD. She was on the committee for 3 months. And Nick Rutter, who's sadly no longer with us, he was a friend of John Harper's, paediatric specialist, and he helped to forge the links with, as it was then, the BPA, the British Paediatric Association, now the RCPCH. So the first clinical meeting was in Coventry. This was run by Sandra Pierce, who was my friend and colleague from when I first started in Liverpool. She was senior registrar there and then moved to Coventry. And you can see from her clinical meeting, she's kept some of her roots from Liverpool by inviting Julian Verboff and Chris Vickers to speak, along with John Harper. The scientific meeting, the first one, was with the AGM, was run by Stanley Blehan. And Stanley Blehan very kindly sent me this photograph of himself and his son receiving honorary degrees at Cambridge. He didn't have a contemporary photograph, but you'll see that management of hemangiomas was an ongoing process in those days and has been discussed for the last 35 years. I'd like to just mention Chris Vickers. He was one of the speakers at the meeting that Sandra Pierce ran. He, once he'd retired, used to do my locums at Dolgellau Hospital, and this is outside the hospital. He was inspired by Ian Snedden to do dermatology, and he and Julian should be accredited with inspiring many other people to become paediatric dermatologists, including myself. So by the mid-1990s, the BSPD had settled into 3 meetings a year. The spring meetings started in the middle 1990s, and these are joint sessions with the RCPCH. Most members may not go to them, but I would encourage the juniors to try and go if you can. It's a joint session with another specialty, either genetics, rheumatology, etc. And if you present a paper or a poster and it's accepted, then you can apply to the BSPD for funding for this, and they're well worth going to. The summer meeting, which is what we're supposed to be having now, but it's now September, and the autumn scientific and clinical AGM. and of course the paper and posters with prizes and guest speakers for all these meetings. This was on the left of your screen was just a newsletter that I used to send out when I was secretary. And you can see that I've flagged up the annual training fellowship at the bottom. And this again is something for the juniors to consider if you want to do either research or further training in paediatric dermatology. So here's the gang, all 14 of us. I won't mention names at the moment because I'm going to run through everyone briefly. So the first lot of presidents were 3-year terms, ending with Nigel Burrows in 2006. And then Pamela McHenry took over with just 2-year terms. And our current chair is Carsten Floor. So here are our first 2 chairs, David and John. I've mentioned them already. This was a social event, as you can see, on the Bosphorus at the BSPD in Istanbul for all us speakers. And it was extremely cold, and John borrowed my wrap, as you can see. Thanks to Celia for this scan of virtually every single brochure of the BSPD annual meetings, and those are what I'm going to concentrate on, not the other meetings. There's far too many to mention. The early ones, of course, are just single sheets of paper, all safely stored in Willen House. And I tried to compile a list of where all the meetings have been. I won't read it out in the essence of time, but I've also highlighted whereabouts they've been in the country. And you can see we've had 3 in Scotland, 1 in Northern Ireland, the rest in England, 1 in Wales, and also 1 in Dublin. So we've had a European meeting, and also, as you'll see later in the lecture, we've had some French meetings. So our 3rd chair was Anne Bingham, who kindly sent me this contemporary photograph of herself. Again, she didn't have one from the time. She was in Belfast and co-hosted the first Belfast meeting in 1987 with her colleagues, which would include Desmond Burrows, Nigel Burrows' father. The AGM meetings that took place during her reign of office were Brighton, Leicester and Wrexham and Chester meeting. And I do have the things from that because I ran it when I was still at Chester, and that was a contemporary photograph of me. We had the academic meeting at the hotel in Chester, the Grosvenor Hotel, which was wonderful. And an evening meal at Salton Hall Country Hotel. This shows the clinical meeting programme, and these are great for junior and seniors to come to, because many of these cases you'll only see once or twice in your lifetime, and you can catch up with old friends. And David and John were both at the meeting, and this patient with the Rossi-Dorfman syndrome that Richard Parsley presented for me turned out to be a patient of David's in London from childhood. So they were delighted to see each other. Cameron was our next chair. He's managed to host 2 meetings. The first was in '91. You can see the programme there, and that was on genetics. During his time of office, there was an AGM in Edinburgh by Savin and Tidman, Birmingham by Celia Moss, and Nottingham, I would think, by Hal Williams. And here you can see his programme. I've highlighted 2 of the geneticists, Sue Hooson and Diane Donai, who will be well known to many of the older ones of you. And they were early members of the BSPD and remained members for many years, and for all I know may still be members. We had a wonderful time at the wine reception and an annual dinner, and you can see the menu there. So thanks to Cameron. And he followed it up 11 years later with another one. And we had a similar wonderful time aboard the SS Great Britain. I highlighted my then registrar, Paula Beattie, who's now in Glasgow, giving a paper on patch testing, and our current treasurer gave 2 papers at that meeting. And you'll see that Alex's home was in Toronto with Bernice Kraftcheck for a BSPD fellowship. So just to flag up again the idea of a fellowship for the members. Celia Moss took over in 97. This is her lecturing. I took a picture of her during one of the meetings. And she gave me a list of her time in the BSPD. And you can see she spent 20 years of her life helping the BSPD. So she deserves a great deal of acclaim for that. Here's one of the symposia that took place during her time. This is the Liverpool 2000, the Millennium Symposium. And Celia also managed to chair 3 meetings, to run 3 meetings herself. Firstly, single-handed in 1996, then with Malobi and Hossein in 2006, and then finally with a whole gang of them in 2017. And Emma Howard and Malobi are both on the committee at the current time. During Celia's year, at the BAD AGM, she invited Amy Paller from Chicago to talk, and this was our hosted dinner. And this is the first one I've got of a number of presidents. There's 7 of us here. During our time, Celia and I and Rosemary, who was my secretary, organised some Franco-British meetings. They were to take place every 2 years. The first one took place when I became president in 2001. Just in case you hadn't realised, for many years the secretaries went on to become presidents. That no longer happens. During my time in office, we had meetings in Paris, Cambridge, Bristol and Dublin. Here's the Dublin meeting run by Alan Irvine, who'd been my colleague in Dundee for 2 years, and also my great friend Rosemary Watson. And we had a wonderful dinner at the Art Gallery in Dublin afterwards. You'll see that I was a consultant in Wrexham from 87 to 99, and then I moved up to Dundee. And during my time in Dundee, I hosted a second meeting, an academic meeting at St Andrews, and the clinical meeting at Dundee with the help of Ross Hearn. This is, I think, the first photograph we've got of a committee meeting, and this was taken in York. I'm quite keen on photography, so I'd organised a camera. You can see, look, Gemma Malario as a trainee rep, Nigel Burrows, David Atherton, Hal Williams. Paediatrician David Mabin was very helpful. He remained on the committee for quite a number of years. It used to be quite difficult to recruit paediatricians. And Graham Sharp from Liverpool and Rosemary Lever from Glasgow. And this was just to show you how we used to have to keep paper copy. I brought us into the electronic age when I was secretary. So Rosemary took over from me. She and Pamela McHenry, a later president, hosted a wonderful meeting in Glasgow in '99 during the middle of Celia's tenure. And Rosemary was a busy lady. There were 3 annual general meetings as always, but also 2 of the overseas meetings, one in Paris and one not overseas, but in Brighton at the BAD. I have to say that more of us went to Paris than the French came to the BAD. And this was the 20th annual symposium, our only meeting up in Newcastle on Tyne with Aileen Taylor and friends. So here we are at the 2004 meeting. This, as you can see, was the social event. We were in a wine cellar and they had arranged a wine tasting competition, which Alex Home won, much to the chagrin of the French. My registrars were Paula Beattie and Colin Clark, and there's Angela Drummond, Rosemary's registrar, they all gave papers. Colin gave his in French, as did Olivia Schofield. And here's the dinner with Celia and Alan Taib. And Jean-Francois Stalder from Nantes was chairing the session that Rosemary was talking in. So Nigel Burrows was our next chair starting in 2006, and the last, as I said, of the 3-year tenures. He's wearing the presidential chain of office, which came into being at that time, and his secretary was Pamela McHenry. He single-handedly, during my presidency, ran a meeting in Cambridge in 2001, and he very kindly ran a paediatric meeting for the Downing Club when I was president of the Downing Club in 2012. And I reciprocated by running one for him in Dundee. And here's the Leeds meeting, here's the committee meeting. It was run by Sheila Clark, a wonderful meeting. Apparently, according to the programme, I also helped to organise it, but I have no memory of that at all, Sheila, but thank you. Thank you for the accreditation. So Pamela took over in 2009, and she's another person who hopped between two centres, between Glasgow initially and then Belfast, and for many years she was between the two, but she's now back in Belfast. And the two meetings during her time were the 25th meeting in Cardiff and a meeting in Nottingham in 2011. And here's the Cardiff meeting. And moving on now to Olivia. This was a picture I took of Olivia at the meeting that we had in India when I was chair of the Dowling Club. And Olivia and her husband James came to the meeting and had a wonderful time. She's the only president, I think, who ran a meeting during her presidency, and this was obviously helped by colleagues. This was it. And the second meeting was down in London at Bart's. Sadly, you may know or may not that Olivia is no longer with us. She lost her battle to cancer in 2017. Her funeral was attended by over 400 people. We had to queue for about 10 minutes to get in. Dermatologists came from over the whole of the UK, and local patients and people from the cathedral. It was a wonderful service. She was sadly missed, and she was greatly supported by Mary, who was her secretary. And Mary's to be thanked for all her recent work on establishing parameters for treating patients with hemangiomas with propranolol. She, during her time as a president, there was a meeting in Manchester, and the 30th annual meeting by our current secretary, Tess McPherson. Moving on now to Ruth Murphy, who is the BSPD president. From 15 to 17, just literally before she started as BAD president, and I'm sure that won't be repeated by anyone. You may not know, she's been made a professor, an honorary professor at Nottingham. She has a degree in medical education, and this shows in all the work she's done. She was on the SAC for 4 years. She's helped develop post-CCT fellowships, and she's developed the education unit Paediatric Dermatology work stream from scratch, as she told me. And this is amongst many other things. The meetings during her tenure was Sheffield, run by Mike Cork, and the last meeting in Birmingham. We move on now to our penultimate president, Lindsay Shaw, who was the first of the duly accredited people. She's both a paediatrician and a paediatric dermatologist, and managed to have 5 children. I don't know how she does it. And this is the meeting during her presidency, which Paula Beattie and colleagues ran in Glasgow. And if you rack your brains back to an earlier photograph in '99 with Amy Pally, you'll see the same group of people except that Lindsay is in this particular picture. So there's 7 of us there. It's a shame David and John weren't at that meeting. I would have liked to have shown you a video clip of all the dancing at the Ceilidh, but there isn't time for that, sadly. And before I move on to the end of the lecture, I would like to mention Helen Goodyear from Birmingham. She's a consultant paediatrician with a special interest in paediatric dermatology. And she's very well known and in the hierarchy of the RCPCH. And she's helped enormously in keeping our ties going with that. She's a very long-term member of the BSPD exec and training committee, and together with Celia developed the dermatology course for paediatricians. So thank you, Helen. Our website is run by Conor Broderick. Thank you, Broderick. If you haven't been on it, you should go on it. It's got a lot of useful information, and it's being updated and improved on all the time. Ruth gave me these links for the post-CCT opportunities for dermatologists. These obviously cover all subjects, but I would recommend our juniors, at least some of you, thinking about doing a post-CCT in paediatric dermatology. So as well as supporting people in the UK, the BSPD does support other people, and the EADV sponsorship's been running since, I think, my term of office around 2000, or possibly earlier in Celia's. This, I'm glad, of Paula Beattie produced for me. She's been looking after them in the last few years. They usually come to the AGM, chosen by the EADV themselves. They come to the AGM and then they spend a week around the time of the AGM meeting at the local hospitals. And briefly, the BAD and the BSPD have both together sponsored this young African doctor, Mesai Tesfaye, who wishes to start a paediatric dermatology service in Ethiopia, in Addis Ababa. And I've been putting together funding for her from these sources. You can see Richard Weller there, and Tom King, who actually did his MSc in Mesai's department on medical education. Mesai's done 6 months of her training, thanks to a number of people in the UK, and was to come back this June to work with Gemma Malario, but obviously that's on hold at the moment. So lastly, here's our current team, the Prof. Carsten Floor, who's also duly trained, and also the first UK NIHR clinical scientist. Tess Macpherson, who ran the 30th meeting in Oxford, and Susanna Barron, who I mentioned earlier, in London. And here's the committee themselves, and you can see there's Gemma Malario. I showed you her as the trainee rep, and here she is as the professor. So I won't read out all their names, you know them all, but thanks to them all for their hard work, and especially to Conor for his work on the website. And I'll leave you with this. I asked Tessa if she could get some future photographs of committee meetings for posterity. And so we leave you with the first and hopefully only post-COVID Zoom of the BSPD exec. I think Cameron seems to have seen, not Cameron, Carsten seems to have seen the light. So thank you all very much, and thank you to everyone who works in paediatric dermatology, not just the doctors, but the nurses and the scientists, to help our patients with skin disease in children. Thank you.